Hi, my name is Kelsey and I decided to do my occupation-based kit on oral care. I think the oral care is really important because it actually shows that person's overall health throughout their lifetime. So I definitely think that it's important to make sure that numerous populations get education about oral care. And the populations that I actually would like to talk about are developmentally delayed kids, because they actually have a harder time getting oral care education and implementing it into their activities. And then the older adult population, and specifically rheumatoid arthritis. First I'll go through and kind of explain all of the tools and supplies that I have here, and then after that I'll kind of go through how each thing would be good with each population. So first of all, I have just your regular average toothbrush. Next I have kind of an electric toothbrush. Then I have two different types of toothpaste. And then I have regular floss. I have flossers. I have floss picks. And then I have mouthwash. So starting with our toothbrush, I think that this would be really good for the developmentally delayed kids, because it would help to increase their motor coordination, kind of like the manipulation of the object in their mouths. And then it also helps with grip strength in that coordination, and it is definitely helpful with promoting any self-care skills. Then I have your electric toothbrush, and I think that this would be good with kids with developmental disabilities, because it would really help with sensory integration, and they would be able to kind of feel that vibrating stimulus in their mouth, and that might actually increase their self-care skills, because they'd really want to use this. I think that this would be good with somebody with arthritis, because it has kind of a bigger grip, and they'd be able to grip this a lot easier, and that would help to decrease their pain. Then as far as toothpaste, I would probably use this toothpaste with helping developmental children be able to improve their bilateral coordination, grip strength, and just manipulation of this object. And then I would probably use this toothpaste for somebody with arthritis, because it's really easy to open. And since it is a flip top, it would help to decrease their overall pain, and then they wouldn't have to overuse any movements, which would cause any increase in pain. Then I have floss, and I have three types of floss. The first floss I think would really help with developmental children, because it would help with bilateral coordination of the movement, kind of opposition of their fingers, and that fine motor control to actually do the flossing action. And then I would use flossers with somebody who had that rheumatoid arthritis and did have that increase in pain, and then they would also be easier to grip. I would use these floss picks for a developmental aged child that maybe had braces or anything like that, to help them increase their oral care skills kind of throughout the day, making sure that there's not any objects in their mouth that they need to get out. And then as far as I have mouthwash, and I think that this is a necessary part of oral care. This I think you would use with developmentally aged kids, because it would help their bilateral coordination, and this seems to be a common just manipulation of a lot of household objects in your home. So just the coordinating of the movement to twist the top and pinch, and that would transition to a lot of other activities of daily living. In conclusion, this is my occupation-based activity analysis for oral care skills.